As the team says, accelerating response for national development, the mission of FoRUT is to empower citizens to fight poverty, corruption, injustice and alcohol and drug abuse through social mobilization, advocacy, capacity building and provision of service for sustainable development. Speaking about the purpose of the meeting on alcohol, drug and mental health, Alassane Jallow, Head of Programs, Foundation for Rural and Urban Transformation, FoRUT.
Our second national forum on alcohol, drug and mental health. This forum, we are doing this in close collaboration with the Ministry of Health and other development partners, including the Cigarette Alcohol Policy Alliance. The forum was called, this is a follow-up to the forum that was called in 2023, the first forum. We are in action point, we are set as to how stakeholders from the perspective of the state actors as well as non-state actors, what role, what specific role should they do in reducing alcohol and drug-related harm whilst promoting mental health. So this session was an interactive session as well as frank discussion for stakeholders to understand what are the successes made, what are the challenges, what are the gaps, and how do we as civil society, how are we as state actors come together in tackling alcohol and drug-related.
Raymond Senesi, representative World Health Organization.
We all know what is happening when it comes to the impact on our health. We know the substances contribute so much to the global burden of diseases. We know the risk to cardiovascular issues. We know the risk to liver conditions. We know the risk to HIV and other infections when it comes to alcohol abuse in particular. And the fact remains, the evidence is clear that with all of this, there's still little work being done to ensure that mental health and addiction services are funded. There's really little being done. And we know that there's a lot of stigma, and we know that millions are suffering in silence, and also that these are people that need help. And to some extent, we have to recognize that issues of mental health should be treated the same way or with the same urgency as other medical conditions are treated.
Representing the Minister of Internal Affairs, Chief Andrew Kakai ESQ, Executive Director, National Drug Law Enforcement Agency speaks.
More than just a dialogue, it's about decisions. It's about making bold commitments to protect our young people from addiction, mental health and alcohol. This year's theme, accelerating response for national development, it's not just a phrase, it is a call to arms. It reminds us that we must act swiftly, decisively and collectively, because the truth is hard to swallow. But all of us know here that if we fail to act now, we are losing the next generation, we are losing future generations.
Delivering the keynote address and the opening of the session, Dr. Aliyu Wui, representative from the Ministry of Health, has this to say.
There is a growing concern on the proliferation of alcohol and illicit drugs in our society. The abuse of alcohol and drugs, as has been mentioned earlier, are high risk factors for mental health conditions and disabilities. The harmful use of alcohol as well as drugs and addictive behaviors have devastating effects on individuals, families, communities, and have enormous socio-economic impact at the national and global level.
Organizing such a forum is another big boost in the fight against alcohol, drug and mental health in every nation. For Amaze TV Top News, Abubakar Siriki Kama is my name.